we're going to talk about mental health and IT, safeguarding our most precious resource, which is happened to be us, the people. I'm Tracy Baggiano. Just a little information about myself. I've been in IT for 20 years. You can find me on Twitter at Tracy Baggiano, which usually Baggiano is hard to spell. So I always recommend just going to my website, databasesuperhero.com. That's usually an easy way to spell it. There's a lot of icons on here. I usually only go over 2 of them. I volunteer as a North Carolina guardian ad litem, which means I'm a child advocate in court for foster care children, and I've been doing that for 18 years at this point, or for advocating for 56 kids at this point. So a lot of foster kids, hopefully I've helped them get into better situations. I am a mental health first aid certified person, so I do know a tiny bit about helping people with mental health issues. And I volunteer on the Disability Rights North Carolina Mental Health Council. So I help drive what we do in the state of North Carolina and what we do towards people with mental health issues and disabilities. So our objectives for this discussion will be discussing workplace causes of mental health challenges, discussing ways to help yourself, discuss ways you can help others, discuss how an employer can provide help, provide plenty of resources for you to walk away with. First, we're going to go over who I am and how I went into wanting to give this presentation, though, because, otherwise nobody would ever want to talk about mental health because it's kind of a scary topic to talk about. And first, I am not a mental health professional, so, this is just, take it as it is, advice. If you really need advice from a mental health professional, go see a therapist or a psychiatrist. I suffer from mental health issues. I have bipolar. I frequently get depressed. I have anxiety. I had with my bipolar, I get manic, as well as, I've been known to buy new cars and new laptops and things like that. And it just gets complicated at some points in my life. And there's nothing I can do about those things. So, and, I suffer from those type of things. My work has been affected by my mental health issues. So when things happen, I've been known to have to, take medical leaves of absences. So I recently had to do that. But my work has also affected my mental health. Things at work like having to work long hours, people bullying me, harassment, which we'll discover later the 4 different things that affect your mental health the most from work. And I decided I was ready to talk about this publicly and raise awareness of it because of the different things that have affected me from work-related things. And then I've done a lot of research on the subject as it relates to IT and found some staggering statistics that I decided that it was time to raise some awareness around it. And you'll find at the end I've got some things about helping you get through the pandemic, but I actually started this presentation before the pandemic, so they just added on some, icing onto the cake, so to speak. I got this quote from somewhere, and then I forgot where I got it from, so then I had to put anonymous to it. So mental health isn't just mental illness, it's just part of being human. So this should be treated just like a physical element. If you got diabetes, you would treat it. If you had cancer, you would treat it. It's the same thing. If you have a mental health issue, you should be treating it just like it's important. So positive mental health is realizing that you have your full potential in life. You're living up to what you would normally be doing in life, and you're not, down and about doing things, and you're actively looking for things and your wellness and your happiness. You're coping with your stresses in life like it's nothing, you just cope with it and move on. You work productivity, you're not down and out and you're not taking naps during the day like I do sometimes. You make meaningful contributions to your community, which I still manage to do with my volunteer work. I don't know how. So some staggering statistics that we're going to see is mental illness in the U.S. affects 25% of people. And you can see the link where I got that from down at the bottom. And most of these statistics I'm going to have links to down at the bottom. So that's 1 in 4. I found another statistic said it's 1 in 5. So it varies depending on where you get your statistics from. But that's 25% of people. That's a lot. But I found mental illness in IT based on surveys 42%. That's higher. Now, there are other professions that suffer from having mental illness issues, because burnout is considered an issue that comes about. And I'm sure, especially after a pandemic, nurses and doctors are suffering from this, tremendously. I found the statistics in the UK are 48%. Don't ask me why, but they're a little bit more stressed out. And a report published in the UK shows that the illness in the UK challenge that 60% of the people report that they're just chronically stressed out, and they're just more stressed out than we are for some reason. And I don't have a reason for that, but the sources there are saying that 52% are just constantly having anxiety issues as well. So it's just one of those things that we can't explain very well. And when you have these issues, you've got to address them at times, and they're likely to be more depressed than the average person over there than over here for some reason. So, and I'm sure that happens in other countries where I can't find statistics as well. So this is a general list of mental health disorders. We're going to concentrate on the ones I've got asterisks beside of: anxiety disorders, depression, and I don't think I have any other ones. Yeah, and because those are what affect you at work. Because those are the ones that will develop at work because of the things that you suffer, because of the 4 things that we will mention that cause things at work. And this is kind of why I'm speaking out now, because I do have personal experience with it. I think that people relate to me better because I've been through things, and it makes it more, more palatable to people because hey, she's been through it. It makes more sense for her to be talking about it. And when I'm tired of the stigma around it, it's just like who cares at this point? It's just part of being. It's life. And people need to realize they're not alone. It's like this little girl walking on this plank here. She looks very alone. Where are her parents? Don't be alone in the world. Then, like I said, I looked at the stats and decided it was time to do something about it. And, everything in your life is just colored through your lenses of your illness. I know when I get depressed, everything is negative. Everything feels like the world is falling apart. And it can be, personal stuff. And if work is making me depressed, it just falls into stuff at home as well. Now, a little bit about my story. I had what I call the debacle of 2018. Now, this started off with a job change in June, which led to some layoffs that occurred 2 weeks later at the job, which kind of sent me into a panic because the place only had 40 people and it went down to 20. And 20 people and 3 developers. Why would they need a full-time DBA? I'm just like, yeah, I might need to change jobs. And then I was out at Sequel Saturday, LA, and this boxcar truck took out my rental car within 5 minutes of me leaving the airport and scared the daylights out of me. And I was terrified to drive in the city after that. And then I had a crisis with a friend I had to deal with. And I was traveling to 2 Sequel Saturdays a month at that point. And this all caused me to have a lot of anxiety with that job change. And I actually had changed therapists during this time as well. And it just led to a lot of different things happening. And I spun into mania with my bipolar, and I couldn't get in touch with my doctor, and I landed in a psychiatric hospital at that point. And it took me a whole year to get stable because psychiatric hospitals are terrible at giving you good medications. That they just take you off everything and stick you on one thing and, call it complete. So I just pretended my way out of that place to get out of there. And then at another job I had after that, I was on call every 3 weeks, and my coworkers rarely answered the pager. And this is a job I had before, and they rarely answered the pager, leaving me basically on call all the time, and I was barely getting any sleep because the pager went off every night. And then I transferred to a job where I was 24/7, where we had to have the system up all the time, 24/7. So that put a lot of pressure not to mess anything up because of the anxiety there. He's working at 2 a.m. to do upgrades, new versions of 2017, and I was using my bipolar superpowers of insomnia to stay awake to do that. So I was getting a little bit of burnt out doing that. Then I had another job one time where I was burnt out as a developer working on the same things over and over and over again, and it seemed just not to end. And then I've been part of layoffs a few times, so it's just like, I can't do but so much. And I talked about my diagnosis before with bipolar, anxiety, and depression. They hit me pretty hard with things. And over the years, I've had the on-call, the development, and the layoffs just cause me different stressors and cause different anxieties, depressions, and things happen. And I'm sure you all have had these different things happen to you. You may not have yet, but if you do, they may cause you to have anxiety or depression or make you feel off kilter and not yourself when or have any confidence in what's going on. So more stats around just depression and things in general. 86% of people would never discuss their mental health with their employer at all, which is, you would discuss your physical health because you need to take time off from work to do things to take care of it. But your mental health, you're like, nope, never mind, nothing's wrong. 44% are not even aware of what healthcare coverage they have at work because no one talks about it. 63% say their employer has not formally discussed mental health at work. Again, because they're not aware of their healthcare coverage. But I'm lucky that, where I work, we had somebody that did a 5K, and our company, he was raising money for it, and our company matched it. So we do have a little bit of awareness there. Not a lot, but a little bit. Now, some other staggering stats are $1 trillion is lost to productivity globally every year to mental health. 210.5 billion is just to depression alone. So that's just money being burnt up and lost because we're not dealing with mental health at all, or not enough. 69 billion is due to suicide, and it's the 10th leading cause in 2019 in the U.S., 18th worldwide in 2016. And this is where I gotta, encourage everybody to, reach out for help. and called the suicide hotline. In Google, if you type suicide at the top, it's the number one thing that pops up is the suicide hotline. So reach out for help, call it, try to get help. Don't take those steps, because that's a permanent solution to a temporary problem. Worldwide, 800,000 people die from suicide a year. For every death, there are 20 attempts. So now on to the work causes of what creates, things like depression and anxiety. One is just stress, burnout, harassment from people, and bullying. And we're going to go into details of these instead of just, naming them, of course. And your stress doesn't necessarily have to come from work, but, keeping systems up 24/7 definitely causes those things, and not wanting to make mistakes. Working on the same things for long hours causes burnout. Telling us to, one thing we got to stop doing is these right here. I don't know if you can see my cell phone. Stop answering them after hours. If you're not on call, get rid of the stuff on after hours. Don't have alerts. Don't check your email. And bullying's just, where people are just mean at work. I mean, I have lots of stories about those. I don't remember if I can remember them all once I get to that slide, but we shall see. So stress and burnout I put together because they kind of go together. A poll of 11,000 people, 56% of people reported they were stressed and burnt out. That's over half the people. So you can actually take this burnoutindex.org test and see if you're burnt out. I was kind of surprised. I took it and I didn't think I was burnt out, and I was. Go figure. My friends probably could have figured that out for me, but hey, I can't. My friends figure out a lot of things for me on my mental health, so before I do. Stress and burnout, a lot of it's being on call all the time and just having to keep systems up 24/7 and checking your emails after hours, checking your Slack and things, and being constantly on, trying to meet deadlines, working overtime to meet those deadlines, worried about layoffs and things, especially when your companies, you see things, the writing on the wall supposedly at work with things happening. You might hear rumors of things happening, and it's usually caused by prolonged stress, constantly being on and using your phone all the time, and staying in Slack and Teams and all these other messaging apps that you have for work. And, it's caused by prolonged intense stress. If you're constantly stressed out, you're going to get to a burnout point. And these are impossible deadlines, and they cause a lot of sacrifice of your time. And usually you're feeling a lack of control because you can't control your time. You can't control what projects you're working on, and you're just constantly working on the same thing over and over and over again. And when you're not in control of those things, that's when you're going to get more stressed and burnt out. Now back to harassment and bullying. Yelling and rude comments. These are, not acceptable at work. Now, I had a coworker one time that when I wasn't at my desk, something got broke. And when I came back to my desk, he's yelling at me, wanting to know what got broke. And I have no idea because I haven't been at my desk. And he's just screaming his head off. And people making rude comments. I've had people, I like to wear white socks, and people commenting on that, telling me I look like Michael Jackson when he was going through all his things with his whatever he may or may not have done with children, and that seemed inappropriate to me at the time. There was a 5'2" manager that was male at my company that the other males that were taller used to make rude comments about his height to him. There was an Indian guy that they used to make fun of him because the way his food smelled, because his food smelled differently than our food. Um, it's just ongoing and ongoing things that, are not fun. And making fun of your colleagues, that goes back to, the 5'2" guy. And, I've had colleagues just make fun of things in my office and things like that. Sexual harassment we know of, but like one story I have about that is a person in my office had a Playboy calendar in his office that got reported to HR, and the HR allowed him to just stick a sticky note over the offensive parts, but allowed him to keep it up in his office. That didn't seem very important, very good. So these things, have a tendency to think not to be appropriate, and leave people's religion alone, or non-religion, whichever it happens to be. But anytime you're making fun of anybody's age, height, what they eat, what they wear, you're inappropriate. These factors can cause one to feel anxious and get it where they don't want to be at work because they don't want to be around people. And then that causes them to be depressed about their job at some point because they just don't feel like, they're contributing that well to work, and they don't want to be around their colleagues. How mental health can affect anybody. One, it can make you sad and irritable. Anytime you start feeling that way, you're headed down the depression side of things, and that's not very good. You're gonna have extreme mood changes, highs and lows. Those can again, they're contributing to depression, or that can be anxiety if you're having your mood changes. You can have excessive fears and worries, or having anxiety. You start pulling away from people and activities. Again, you start isolating yourself. That's more of a sign of depression. And your changes in your sleep and eating habits, that's a sign of depression as well. And you have trouble concentrating. That's another sign of depression. So anytime you start seeing some of these things happening, you need to be aware that things at work or things at home, or the combination of the two, are starting to affect you. How things have affected me, I've missed work. I've had a couple of times where I've had a leave of absence and then, psychiatric ward stay. I have, lack of focus a lot of times, lack of motivation to do anything. Some positives I have, unfortunately, I do have some positives with bipolar. I get extreme energy. Yeah, that's great until it goes away. I work well under work stress situations, which is very weird because I guess it comes from my childhood of having um, been under a lot of stress as a kid. So we're going to go over some ways to avoid burnout in IT, and I think there's 10 of them if I remember correctly. One is to take some time off from work. If you're starting to feel burnout, take a day or two off, go do something you like to do that makes you happy. I've been told this several times. I never listen. Identify stressful tasks. If your tasks are getting stressful at work, try to see if your boss will help you divide those up, get someone else to help you with those. Unplug at the end of the day. If you're not in charge of being on call, don't look at your phone. Don't look at your computer. Turn it off. Eat well and exercise. These things help you get well and make you feel better overall. Socialize. Try to get out and see people that you like to be around, and That will help your overall self-esteem and help you not isolate. Develop an escape plan. If you're in the middle of a stressful situation, find something you can go to do that's not so stressful. Get plenty of sleep. Make sure you're sleeping at 7 or 8 hours or whatever amount of hours, because I know someone who doesn't need that amount of sleep. That makes you feel better. Cross train people on what you're doing so that you don't always have to be the one that does it. Learn to say no. Yeah, people have told me that. I don't know how to do that either. But you may have to tell your boss that, hey, I can't take on more projects right now. I've got too much on my plate. Things you can do for yourself to help take care of yourself are to eat well, exercise, and sleep. Like I said, we just covered those things, and those things are 3 very important things you can do. Develop hobbies away from the computer. Yeah, I've been advised to do that as well, and well, I haven't done it yet, but everybody else should follow my advice. Get away from social media. Sometimes social media is so negative. I recommend on Twitter to mute some words. I know Chrissy Lemire has a Twitter thing where she's got a whole bunch of muted words you can use, and it's helped my Twitter feed basically get all the political crap out of it. Do some light therapy, especially during the winter time, or if you live somewhere that doesn't get a lot of light, so that you can get your vitamin D and feel better. Do some relaxation training, yoga, um, just some meditation or anything like that. That just helps you relax. Spend time with your family and friends. That's always very relaxing for anybody, is to be able to spend time with people you like. Where to get help from? Um, if these things aren't helping, you first at work, you need to talk to your boss about the things that are very stressful to you at work. If that's not helping, you may have to go up to HR because your boss is not helping you, and you may need to seek further help. If these things aren't helping and you don't need your boss or HR to fix it, you may just talk to a friend about it, and it just may make you feel better to talk to someone that understands your situation. You may need to see a therapist to kind of help you work through things. And you may just need to see a doctor to get on some medication or something to help you work through your anxiety and depression while you're working through some of these other issues with your boss or HR. But if you're working at a place that has all those weird stories that I was telling you, you may need to find a different job. So there is that possibility as well. What you can do as a friend, listen non-judgmentally. Don't try to tell your friend exactly what to do on everything. I have one of those friends that thinks they know everything on what they should tell me to do. I think they've been reading the internet. Ask questions that show you care. Don't assume that your questions are exactly what they want to hear. Make sure that you're showing that you care and that you're not just, pounding away at them. Be very patient as they try to answer the questions, or they don't answer the questions. They may just feel like, having company and not talking at all. Don't be critical. This is where, if somebody says, they don't feel like exercising at this moment in time because they're tired, don't sit there and tell them 20 times to exercise in one lunch. Check in on your friends. If you hadn't heard from a friend in a while and you think they might be depressed or something, check on them and see how they're doing. Don't be confrontational. Don't, confront them and make the situation even more worse by jumping up in their face and saying, hey, you need to do this, this, and that, and make things worse. But do be honest about your concerns with them. You can do this with by showing that you care, by being patient and checking on them. But you don't have to do it the other ways that we mentioned. Some things not to say to people, because I've been told all these things, so I like to put this slide deck in here. It's kind of fun. So pull yourself together, that's always going to work. Snap out of it. Now you snap your fingers and everything's going to be all better. Just pray about it. I do go to church, so I get told this all the time. You have the same illness as my friend, blah, 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 so you should do blah, blah, blah. Not everybody's even on the same medication for the same thing, let alone can do the same thing to fix it. Just distract yourself. You don't need medication. Oh, I love when that one happens. It's like, yeah, I'm just going to go off my medication and let's see what happens. I know what happens when you go off medication because I've done that before. It's not good. Ask what you can do. Oh, that one's not supposed to be there. I forgot to take that one out. Stop acting crazy. I don't know where that one comes from. Just don't worry about it. Yeah, I wish I could just not worry about it. Cheer up. Therapy is for people who are weak. My dad told me that one. That one's a very good one. Things will be better in the morning. Yeah. Stop focusing on the bad stuff. Yeah. What to say to people. You can be honest with me. So you want them to open up to you and be honest and tell you what's going on. Do you want to go for a walk with me? Sometimes people are more open when they're side by side with people and more than they are with across from people. This is something I learned in my mental health training, because if they're facing each other, it feels more confrontational. How's your treatment going? If you know they're in treatment and they've confided you in that, you can ask them about it. Can you help them find help? If you know that and they've been open about the fact that they're struggling, see if you can help them find help. How are you really doing? Instead of how are you doing, stick to really in there, because you want to really know what they're doing. Because if you ask them how they're doing, if you ask me anyways, you're going to get a fine, and that usually means, you're not getting the right answer. Do you want to go out and do something? See if you can try to get them out to do something that they enjoy, and, try to get them out of their house so they're not isolated. Tell them how glad you are to have them in your life, because that sometimes will help them at least hang on to the fact that things aren't so bad. And then try to help them remember when something good had happened in their life and something that you guys had done together that was good. Now, what can we do as employers to achieve wellness? One, we can create open vacation policies. These policies where you only have like 2 weeks vacation or 4 weeks vacations are crap. Because you get sick, you want to go on vacation, you need mental health days, people don't take all their vacation anyways. When you do open vacation policies, they have a tendency not even to take them anyways. Offer flexible work arrangements. If somebody needs to come in at 9 instead of 8 because of things are going on in their life, let them. Don't tell them that, they got to go to doctor's appointments during lunchtime when doctors take lunch. I've had that problem before. Honor a 40-hour work week, because there have been studies done that if you're working an 11 hours workday, you double the risk of depression. And if you do it a lot, you lose your cognitive loss after a 55-hour work week. So you just start declining in your ability to do stuff. And it's an early predictor of dementia and death, the more hours you put in. Respect boundaries. If anybody wants to do certain things, and you need to respect their boundaries around their hours and their work life, and not potentially tell them they can't have those. Reconsider the open plan office spaces. These office spaces where everything is open and everybody's out and about. Everybody's just wearing headphones anyway, so it's really not doing any good. There's no collaboration going on. Go back to some office spaces and give people their privacy. And offer comprehensive health insurance that includes mental health. That's critical to getting people the mental health that they need. Educate and learn to develop empathy. There's a link at the end that is called Workplace Mental Health Topics that you can go to a website and you can learn about different mental health topics as an employer or as a manager to help you understand different mental health issues. So if you find out an employee of yours has one, you can go read up on it and understand what they're going through and help you out. Provide accommodation for employees. The Job Accommodations Network has suggestions for that, and that's part of the ADA that was passed a long time ago. And lead by example. Set your own healthy boundaries. And, take mental health days. Work 40 hours. Don't work 50 million hours. Practice your self-care and be asking for help when you need it. Now, what do employers gain by doing this? They get improved attitudes towards mental health and decreased stigma around mental health in their workplace environment. The employees engage more at work. You get more productivity and creativity at work. Overall sense of well-being. They trust the workplace more. They get more satisfaction with their leadership. So, the CEO and the higher up people they're more satisfied with, or even just their own manager. Get interpersonal relationships at work improve better. So just among your own teams, you start feeling better. They get more commitment and loyalty to the company. You decrease your inefficiency and errors. That's probably more important in IT and development, which is what we're talking about here. People don't stay out of work as much, and people don't switch jobs as much, because that costs a lot of money to switch jobs, and you don't lose as much money due to people missing work. The good news is 80% of treated employees report improvement. So, if we got 42% of people missing work and 80% of people are improving, that's, a great milestone for IT. Now, on to surviving the darn pandemic, because it's still going on and we're into the Delta version of the pandemic, and well, it doesn't seem like it's ever going to go away, but it might. So one is to stay connected to people. Schedule socials, even if it's via Zoom. If you're vaccinated, you can do these together now. You might be unfortunately spreading to people that are not vaccinated, but we gotta encourage people to get vaccinated. Don't just write to people, because they need to see people to help. That's basically don't text all the time. Check in on others you hadn't heard for a while. Share your experiences that you're going through. Remain calm. Don't panic when you see things on the news. Basically turn off the news. The news is just, depressing. Use local news websites to stay up to date, like the WHO or the CDC. Do something for yourself. Go for a run, read a book, clean the house, anything that makes you happy and feel like you're being productive instead of just, sitting around doing nothing because you're panicking over the fact that the pandemic's still going on. Back to happiness. Get outside if you can. Get some exercise. Accept that you're not perfect, because things are going on that you can't control. Look for the positives in life. Practice mindfulness. Again, that goes back to yoga and meditation. Coping, set boundaries between life and work. As soon as work's over, shut everything down. Don't look at your phones for work. Have a designated work area in your home. Try not to be working in your bedrooms as much as you can. If you're doing it at the kitchen table, as soon as everything's done, clear it off. Establish a routine close to what you had before. If it took you an hour to commute to work, try to do something then in that hour that's similar, that you're using, that you wouldn't just sit around and do nothing. Take breaks from your 8 hours that you normally would do, like get up and walk around the building or something, or walk around the block so that you're doing something besides sitting at your desk. Protect your health. Physical and mental are intertwined. So again, go outside if you can. Get some exercise. There are tons of videos online. Lots of stuff was put on YouTube. The expensive Peloton bike is what everybody keeps telling me I should get. I don't know if I'd use it, so I'm not going to get it. So do some meditation, yoga, eat healthy. That's another thing that's pretty important. Quit using Uber Eats and stuff to get things sent to your house. Sleep well. Stress has a tendency to mess this up. Try not to be working from your bedrooms. Stay out of work stuff after hours. Try to feel a sense of fulfillment. Productivity can feel like it's down when working remotely. Don't overwork. Don't do what you can. If you can't get so much done because you got kids at home or you got to take care of people, communicate that to your manager. Take regular breaks again. I try to get up every hour and move around the house and do things. Right now, I'm not able to do much because I have a shoulder that's like messed up. So, chat to family and friends and colleagues, not about work. Set an agreement with your boss on realistic goals about your situation. Stick to a routine. Feel a sense of accomplishment even in small tasks. I have the Full Focus planner as my planner that comes every 3 months, and I go through and I set goals for the year and try to set the big 3 things I'm going to work on for the week, and then the 3 things I'm going to work on the day that helps me get to the things I'm working on for the week. And I go through that, and then I've got the little tasks that I need to just get done. And look for others that might be feeling alone so that you can help them out. Okay, we're back to this quote, so that means we're basically done. So I might have finished a little bit early because I feel like I talked fast. So mental health isn't just mental illness, it's part of being human. So just remember, mental health is intertwined with your physical health. If you're not feeling well mentally, you're not going to be feeling well physically. So I got a lot of resources on here. These are a lot of podcasts I listen to. I know some of them have been discontinued, but they're still out there to be listened to. So I know The Hilarious World of Depression was discontinued about a year ago, but it's still out there, and it is funny. But they replaced it with, I'll have to find it. I have to upload a slide deck and find it. These are some blog posts from some people from the community there that have been, that talk about depression and stuff. The last one's where someone did a T-Sequel Tuesday about it, so you can get a whole bunch of different links to different people that did it. These are all the resources I use to come up with all the information I have in the presentation, which is like 4 or 5 slides. So I did a lot of research. This is a evaluation you can do. This was made for firefighters, but I think it applies to everyone. You can tell what category you're in based on these things. So if you're calm and steady, you're doing fine. If you have the ability to take things in stride, you're fine, and so forth and so forth. So I would recommend looking at this and seeing where you fall into what category. If if you're in the orange and the red, I'd recommend seeking out some help on the professional level because you might be struggling a little bit. Any questions at this time? Maybe put them in the chat. I'll take that as a no. I just want to thank everybody for coming. And again, the easiest way to reach me is databasesuperhero.com. I did not put the QR code in here for the evaluation because I forgot, but
I actually posted it here.
yay.
No worries.
So if you guys can fill that out for me, I would appreciate it.
Most definitely.
I always like feedback, good, bad, or indifferent. So I hope everybody enjoyed it.
I did. Thank you very much, Tracy.
And so if any, like I said, I don't know if anybody has questions, but I'll go over to the speaker room and see if there's, or wherever the room is for this room, and see if there's more going on.
So I do have a question. I think this one's interesting. If you set up one of those open vacation policies, how do companies manage those that actually try to abuse it? Because there's always going to be usually, somebody that does abuse the system. So how would a situation like that should be handled?
Well, you still got to get it still has to be approved by the manager, the vacation. I was at a company that had one, and most of the people didn't take advantage of it, but you had to get your vacation still approved by your manager. So your manager would still have to approve it. And I see a question about what an open vacation policy is. It's basically where they don't have a set number of days for vacation. You can take as many days as you want. And so people could take, 6 weeks, 4 weeks, whatever they needed to take based on what their situation was.